Hello everyone. Today I will present the topic of the discovery and use of cancer biomarkers. I will start with the definition of some terminology. Biomarkers is referred to biological molecules in our body that indicated to normal or abnormal physiological process or even the disease arising in our body. The biomarkers can be derived from blood, body fluid, or any tissues. So, cancer biomarkers represent two biomarkers that can be detected when the cancer is present. Cancer biomarkers may require the special assay beyond routine clinical, radiological, or pathological examination. In the past, patients with a particular cancer type all received the same treatment, but the research has shown that tumors have unique features even within the same cancer type. Now, physicians are increasingly using cancer biomarkers to gain more information about a patient's tumor to predict the treatment that is most likely to work against unique cancer. Cancer biomarkers can be divided into three groups, including of diagnostic, prognostic, and predictive biomarkers in the patient at least. Diagnostic biomarkers refer to cancer biomarkers that showing the performance in diagnostics, screening, and monitoring of cancer. For prognostic biomarkers, indicate the natural cause of disease in terms of cancer that determine tumor recurrence and aggressiveness. Finally, the predictive biomarkers is for evaluating the treatment effect on a particular cancer. These can predict the patient's will subsequent respond or unrespond to the treatment. For the methodology, cancer biomarkers is originated from the great discovery of cancer biology. The advanced understanding of cancer science, together with cutting-edge laboratory methods, have provided various kinds of cancer biomarkers that refer to real-life clinical practice now today. The biological molecule that related to cancer, for example, DNA, RNA, protein, enzyme, metabolite, epigenetic, or cancer cell itself, can be detected and related to tumor behavior or clinical relevance. Basically, gene expression profiling, abnormal gene fusions, or translocation, including the mutation analysis, can be obtained from the set of DNA or RNA of particular tumor by using FISH, microarray, real-time PCR, or sequencing technology, especially to the high-throughput methods like next-generation sequencing for DNA or even RNA sequencing. This genomic approach undoubtedly drives the cancer biomarker discovery based on the central dogma of biology. For the part of protein or enzyme and also metabolites of the cancer, the detection by immunohistochemistry staining of the tissue, as well as Western blot technique for the detection of protein of interest in particular cancer, are so common. Moreover, the development of study in proteomic metabolic profile that correlated to genomic profile by using mass spectrometry will support to the useful cancer biomarker detection. Interestingly, the epigenetic control like DNA methylation or histone modification in cancer provide our understanding in tumor behavior and also can be detected by methylation analysis assays such as restriction enzyme-based or bisulfite-treated methods. Moreover, the circulating tumor cells and circulating tumor DNA detection subsequently result to discover the new way to screen, monitor, and study in terms of biomarker of cancer. All the methods of the molecular techniques to investigate each part of cancer will be studied in scientific model. The scientific model have been through verification, optimization in clinical study, and proceeds to clinical implementation. However, there is a room of improvement for any kind of cancer biomarker. by this concept of ideal cancer biomarkers, including the decent tumor-specific proper sensitivity to detect minimal level of micrometastasis, but not detect any non-specific molecule in healthy individuals, along with correlation of level to the tumor size and ability to detect cancer recurrence before clinically detectable and certainly cost-effective. For the way of the applications, the cancer biomarkers can be applied in the real-life clinical practice and research setting regarding two categories of biomarkers. It can assess risk for developing cancer in patients in terms of diagnostic biomarker for screening purpose or diagnostic performance. Some cancer biomarkers can determine the risk of recurrence or aggressiveness of cancer that represent two prognostic biomarker. Moreover, it can predict the treatment response by specific therapy as a predictive biomarkers. The utility of cancer monitoring to assess disease progression could be derived from the methods of minimal residual disease detection. Interestingly, some cancer biomarkers can guide the treatment by using drugs to target the actionable lesion of the tumor. And cancer biomarker can provide new information for research and development to understand cancer biology and develop new therapy of cancer as well. Some examples to enhance the cancer biomarkers performance include the use of combined biomarkers rather than single biomarker. And some of predictive models include the gene panel to determine the significance, such as the Oncotype DAC that use 21 gene panel for indicated the recurrent risk of breast cancer from the calculation of recurrence score gene panel profile. Furthermore, using gene signature combined to clinical characteristics also show a good performance to be a good prognostic biomarker. For example, M750 in follicular lymphoma patients that require 7 genes with critical features to determine the tumor behavior and overall survival of patients more precise than conventional 3P score. This table demonstrates the example of cancer biomarkers according to tumor types. Some biomarkers can provide more than one performance, such as hormonal status in breast cancer, especially in ER or estrogen receptor, that can guide treatment to use the tamoxifen and also provide the prognostic information. If the estrogen receptor positive, it will be interpreted into luminal category in molecular classification of breast cancer that have a better prognosis and survival. Another example such as lung cancer with EGFR or epidermal growth factor receptor in adenocarcinoma of lung can guide to use of tyrosine kinase inhibitor targeting EGFR such as gefitinib or erlotinib, and this serves to explain the superior prognosis than EGFR negative adenocarcinoma of lung. CD20 is a marker of mature B cell that can be used to diagnose B cell malignancy such as the B cell lymphoma by integrating to histopathological investigation. It can provide discernible benefit to patients by using monoclonal antibody to CD20 such as rituximab in the part of treatment. BCR-ABL or BCR-ABL fusion gene can encode BCR-ABL oncoprotein in patients with chronic myeloid leukemia. We use BCR-ABL in the cellular morphology together to establish the diagnosis, guiding therapy with using tyrosine kinase inhibitor targeted that, and monitoring the amount of BCR-ABL protein to follow up the treatment response in CML patients. In conclusion, the discovery of cancer biomarker result to understandings of cancer development, treatment response, also resistance mechanism. Because of the expansion of knowledge of cancer biology and advanced technology of molecular methods, we can use cancer biomarker for diagnosis, prognostication, and predict the treatment response according to several kinds of cancer biomarker performance. Thank you for your attention.